In response to the ongoing COVID-19 pandemic, for the first time in Solve's history, we launched a fifth global challenge, the Health Security in Pandemics Challenge. We felt a responsibility to mobilize our global community to respond to the current COVID-19 crisis and to call for tech solutions that would help us prepare for future crises. We sought solutions that answered the question, how can communities around the world prepare for, detect, and respond to emerging pandemics and health security threats? In a time of extreme uncertainty, we were genuinely uplifted by the technological solutions we received from social entrepreneurs across the globe. 736 solutions hailing from 95 countries. This is a moment that demands innovation, and it is my pleasure to introduce you to our 15 finalists, starting with 5 incredible entrepreneurs working on disease detection and mapping, as well as community recovery.
I'm Aditya Sharma, founder CEO of Sparrow Analytics, and I'm here to talk about MapSites. COVID-19 pandemic has left communities and countries in disarray, India being no different. However, amidst the gloom, we see an opportunity for a transformational change in India's data governance. MapSites is a geospatial decision support system that sits at the crossroads of GIS, data science, and epidemiology, making sense of the huge volumes of data. Intuitive customized maps at varied scales from a block to a city and onto bigger geographies provide a geospatial perspective of the pandemic. With the state of Haryana and India as our implementation partners, we are building an application for the present and the future. The application is also repurposable for diverse end uses, increasing its horizontal scalability. MapSites empowers the citizens, helps the planners, spawns further research, creating immense knowledge and benefiting the people. Thank you.
Hi, I'm Patipat from PODD. Our big question is, how can we prevent the next pandemic? 70% of human diseases are zoonotic. They spill over from animals to humans like SARS, Ebola, and COVID-19. With PODD, we can stop outbreaks before they spill over. PODD democratizes outbreak response by turning community members into disease detectives. Here's how it works. Villagers report suspicious outbreaks via smartphone. They collect photos, visible symptoms, and GPS location and send it to PODD. If PODD detects the potential outbreak, the system sends guidance to the reporter to take quarantine actions. We have identified 75 pre-spillover events. If you look at the damage from the current pandemic, you can see how important early detection is. PODD catches animal outbreaks before they spread to humans. So now we can stop pandemics before they happen.
Hello, I am Amani Salim. I'm a co-founder of Nanoscout Works in Berhad from Malaysia. We're using nanotechnology, which is called a nano-engineered sensor dot, that is cheap, simple to implement, easy to scale up, and has been tested in our initial diabetes version and costs less than $1. NSD is actually a combination of graphene and conductive polymer that can improve sensors technology by 100 times, improve detection limit by 100 times, and also provide instantaneous sensor response, which is less than 1 minute. We have done protein engineering to improve selectivity of sensors, using NSD to improve the sensitivity and limit of detection, in lateral flow assay format for SARS-CoV-2 detection. It's actually, if you imagine, just a pregnancy test kit, using the NSD can improve the performance of the sensors. We will adapt this NSD into existing glucose sensor strip for detection of SARS-CoV-2, and because it is cheap and scalable, it's easy to deploy in lower and middle income countries. With the massive existing device base, we can also commercialize this device. Thank you.
Ganesh got infected with a mosquito-transmitted disease called dengue, and it took 3 months to recover. Their family income was $150 per month, and their medical expenses were around $2,500. Ganesh luckily recovered, but his dad died of poverty after 8 months. Mosquitoes infect around 750 million people, causing several million deaths and cost around $100 billion per year. The best way to control mosquito-transmitted diseases is by controlling mosquito populations. Our disruptive and patented solution uses deep technologies, IoT, and AI. A network of smart mosquito traps are deployed across the city. Smart traps use sensors to count and identify mosquito species, where and when control is required, and the efficacy of the control efforts are based on real-time data. Additional critical data points like disease occurrences, breeding points, and weather are collected and are used to predict the outbreak of the diseases. Let us join hands to make a difference. Thank you.
I'm Mike Lenahan, founder and CEO of Public Sentiment. Public Sentiment uses community engagement, smart data, and policy design to help local governments create greater social, financial, and health equity for all. When COVID-19 struck New York City, policymakers and issue experts didn't know how to respond to the diverse needs of unique communities across the city. Instead, solutions were one size fits all. We solved for this by creating a place-based process where policymakers, residents, and issue experts are both the sources and recipients of knowledge and ideas. Together, in partnership with policy experts and our partners at NYU and Berkeley and 70 partners in Brownsville, Brooklyn, we've put this to use to create a social infrastructure and digital tools to effectively respond to COVID-19. Here, residents can take monthly surveys to map stressors and coping mechanisms, get real-time information about issues facing them, and join working groups alongside policymakers to scale programs that address needs. If brought into the Solve community, we would be able to scale our COVID solution faster and further. Thank you so much.
This pandemic has shed a sharp light on the chronic failures in our current health system. The finalists you just heard from are working on slowing and tracking the spread of disease by improving methods of detection and streamlining rapid response. Our next 5 innovators are focused on solving the difficulties facing the vital clinical supply chain and addressing the needs of healthcare workers for clinical tools and methods of protection.
Hi, my name is Sheila Kyoko from Living Goods, and our solution is digitally enabled community health workers combating COVID-19. As a nonprofit organization, we strengthen community health programs by ensuring access to affordable health services. We have enabled 10,000 community health workers, reaching 8 million people with a mobile device and an integrated mHealth application that allows community health workers to assess and manage sick children and provide maternal health services. Links to health facilities for case referral is also possible, and follow-up on immunization defaulters. In COVID-19, program continuity was made possible by integrating COVID-19 workflows in maternal and child health services, client-initiated health assessment, and program dashboards for surveillance by governments. This data was made available to governments for continuity and programming. Our team of community health workers, supervisors, and government officials have made this possible now, and we work with them to scale this beyond our current reach.
Imagine you're a doctor treating COVID patients, and because of PPE shortages, you have to reuse your N95 mask. Larger hospitals can sterilize masks between uses. Staff will collect and barcode the masks and transport them to a facility for an overnight sterilization process. That's great. But smaller hospitals don't have the staffing, the money, or the experience to do that. So what do? They just keep wearing the same mask between patients. It's a huge cross-contamination risk, but what else are they going to do? That's why we invented a device that decontaminates an N95 in just 60 seconds. Imagine you're a doctor exiting a patient's room. You take your N95 and put it in this chamber. Your mask is then decontaminated while you remove your cap, your gowns, your gloves, your booties, and do your wash up. By the time you're done, the door swings open, you reach in, grab your N95, and head off to your next patient. It's affordable, and it doesn't require a centralized collection facility. Finally, a solution for tens of thousands of clinical settings all around the world.
The current stockpile of personal protective equipment, or PPE, is insufficient to meet the requirement to combat a global pandemic. And the current waste management system is often unregulated that contribute to environmental pollution. In 2015, our team member Dr. Mubarak Ahmed Khan was able to develop the biodegradable polymer sheet from jute cellulose. We were also able to extract chitosan, a polysaccharide derived from shrimps and shells of local industries with antibacterial and antimicrobial properties. Our solution is to develop a set of PPE and spray it with chitosan. From our preliminary findings, we know that chitosan sprayed jute cellulose can be dissolved in alkaline solution and can be dissolved in water. From there, they can either be drained into the environment or can be taken back to the laboratory to be recycled. With your support, we plan to develop a prototype for scale-up, and here I present to you the team leads, and thank you for your time.
Imagine a mother being unable to access malaria treatment for her infant, hospitals running out of medicine, and a country not knowing what disease poses a threat. This is the heart of health security and resilience planning, which has been better exposed by the COVID-19 pandemic. These four things have stood out in battling this call: preparedness, resource availability, response capacity, and collaboration framework. ASA is an artificial intelligence-driven platform that could help countries be better organized to anticipate disease patterns, forecast demand of healthcare products, enhance collaboration, and mobilize resources to combat health threats. By ensuring a population that solely depends on the public healthcare has just-in-time access to essential treatment, a country's overall state of health security can be greatly improved. From the pilot we ran in Kenya, we have learned that the platform can become an effective, robust network of coordinated responders. ASA can also unlock the over $200 billion marketplace of healthcare products and boost Africa's local industry. We look forward to work with you to scale to the rest of the continent. Thank you.
I want you to close your eyes and focus on your breathing. See how great that feels? Well, there are currently hundreds of thousands of people who can't do that. And what's worse is that they're getting sicker. This breathing tube came from an actual COVID-19 patient, and you see that gray stuff? That's why 30% of these people are getting bacterial pneumonias and dying. NEVAP has created a breathing tube that prevents this problem and is being used in the US, UK, Chile, Mexico, and Peru, where it is already saving lives. So far, we've donated over 15,000 of these special breathing tubes to help the sickest and most vulnerable patients all over Latin America. Our goal is to have an impact and help people breathe again. We believe everyone deserves the right to breathe. Thank you.
Though we are still contending with the COVID-19 pandemic, climate change and globalization leave us ever more vulnerable to future epidemics and pandemics, and it is critical to be prepared. With this in mind, many of today's finalists have kept an eye toward future outbreaks, including our last 5 innovators, who have all submitted solutions around prevention, from vaccines to vital research and patient services. I am so excited for you to hear firsthand about the essential work they are doing.
Did you know that every year more than 50% of vaccines may not reach their intended beneficiaries due to issues related to tracking and wastage? If these same systems are used for a COVID-19 vaccine, we will not be able to verify delivery, making it almost impossible to truly eradicate the disease. We propose our facial recognition solution to enable partners to verify the delivery of every single vaccine at the last mile. This becomes all the more important if the COVID vaccine is a multi-dose one, as biometrics can enable health workers identify those who have fallen through the cracks and follow up with additional doses. Our solution has been designed with frontline workers and put user safety first. It also protects beneficiary rights by following strict GDPR protocols. We have proven impact in maternal health, HIV, and other infectious diseases, and we predict a 20% increase in the number of people that receive the full course of the COVID-19 vaccine. The MIT SOLVE program will help us establish collaborations to build sustainable, long-term solutions for delivering health services using digital tools. Thank you.
1.5 million. That's the number of deaths globally from vaccine-preventable diseases every year. There is a growing tide of counterfeit vaccination certificates contributing to this problem. Enter Vaxi Global. How does it work? It's pretty simple. Our solution utilizes cloud computing and mobile technology to create a digital health certificate that can be easily shared by doctors and be verified by immigration authorities through QR codes. This simple process creates digital certificates that can be verified securely, stemming the tide of counterfeits and saving lives. Our solution is practical, easily scalable, sustainable, and can be effortlessly integrated into existing healthcare solutions. Vaxi Global, protecting your freedom to travel.
My name is Nico Moore, and I'm the business development lead at Flair. Imagine getting into an accident and not being able to get help in time, or having a sick child in the middle of the night and not being able to get them to hospital. In Kenya, despite having numerous ambulances, the lack of coordination forces people to either walk, take public transportation, a taxi, or never even get to hospital. Unfortunately, this is a reality for more than half of the world's population. At Flair, we aim to solve precisely for this. We leverage existing ambulances and aggregate them onto a centralized platform, similar to how Uber works. We've also built a 24/7 world-class dispatch center that's manned by medically trained dispatchers who can dispatch an ambulance across the country in minutes. Over the years, we've responded to thousands of rescues, including most recently COVID-19 cases. And we all know that due to the global pandemic, lack of a global 911 system truly exposes a country. So join us in building a global 911 system where everyone has access to life-saving care in minutes. Thank you.
Mozambique, like many low and medium income countries, has a vast majority of the population living below the poverty line. This underprivileged demographic live in remote areas, often far from the nearest health facility, making them extra vulnerable to health security issues. It is with this in mind that we developed an mHealth platform, PENSA, based on USSD, unstructured supplementary service data. Through this technology, users can access through any phone 24/7 and through any network health information free of charge. The Ministry of Health partnered with us to deliver information to the citizens, and it has since turned into a cornerstone of the national fight against COVID-19. PENSA is indispensable to many Mozambicans as it is their only source of health information, so much so that every month we receive over 1 million spontaneous users accessing the platform. Thank you.
Antibiotic-resistant infections caused by so-called superbugs are expected to kill 10 million people yearly by 2050. That's nearly 10 times the annualized death rate from coronavirus. We're working on a technology to decrease antibiotic resistance deaths, and we're focusing our efforts in Africa and Asia, where 90% of those deaths are expected to occur. While antibiotics cannot kill superbugs, there is a class of drugs that can. These phages were used as antibacterial drugs even before antibiotics were discovered, and they're remarkably safe, effective, and relatively inexpensive to produce. Phages are undergoing a renaissance in the US and Europe, but there are almost no phage experts in the developing world, where they're needed most. Our organization is bridging this gap by teaching scientists in Africa and Asia how to develop phages as antibacterials and helping them bring those products to market in their countries.